next guest has over 18 years of experience as a vascular surgeon, originally from Philadelphia, trained at Boston University and written numerous publications and has given presentations in the area of peripheral arterial disease. Now, here to discuss this is Dr. Malone with the Center for Vascular Medicine, and we want to say welcome to Let's Talk Live.
Thank you.
Okay, so we're talking about peripheral arterial disease, and of course, my first question is going to be, can you tell me what it is and how do we prevent it? And I know that we're getting you mic'd up. There we go. There we go. So tell me what it is, Dr. Malone.
Sure. Thank you, Julie. Peripheral vascular disease is actually an entity of diseases that involve primarily the peripheral circulation, and the problem is that you have occlusion or narrowing of the vessels from atherosclerotic disease.
Okay.
And it can cause claudication, meaning pain when they walk. You can have pain when you're at rest, to the point where it gets so bad we can actually form ulcers or have gangrene of the toes.
Okay, and we're looking at pictures right now.
This is a picture here that shows on the left side a normal vessel where there's normal flow. And when you have peripheral vascular disease, you have atherosclerotic plaque building up in the walls of the vessel that can narrow the flow and cause decreased flow when you try to walk, decrease
mobility.
You can have difficulty.
Now, can that cause clots as well?
That's actually on the venous side.
Okay.
Arterial disease, like I said, the difficulty is that you can't really get around like you like to. If you have an ulcer, the ulcer may not heal because of inadequate circulation.
Okay. And so what are the symptoms? You mentioned pain.
Right. You can have pain. You can have numbness.
Okay.
People can also have difficulty with wounds healing. If you clip your toenails, they may not heal appropriately. They'll notice that their nails are thickened. You see this picture here. This is actually a pretty severe case.
Oh my goodness.
Where the patient can actually have gangrene of the toes, and that's pretty significant emergency. So what we want to try to do is avoid that. If we can interact with it sooner, we can take care of that so we don't run into this problem.
Right. Now, who is at risk for PAD?
The risk factors, we used to think that peripheral vascular disease was separate from coronary artery disease, and what we found is that actually the risk factors for peripheral vascular disease are the same as those for coronary artery disease, meaning elevated blood sugars, elevated cholesterol, and the biggest one for us is smoking. I mean, there have been studies that looked at patients who we've operated on or done procedures on, and we looked at smokers versus non-smokers, and overall the smokers do worse than the non-smokers regardless of what we do. Here's a picture here that shows that patients who have peripheral vascular disease in the United States, it's between 10 and 15 million people. And the problem is that it goes underdiagnosed, unfortunately.
Yeah, because it almost, because you said elevated sugar levels, somebody like with diabetes would have problems, you know, with like small wounds healing, that sort of thing, which is one of the symptoms you were talking about.
Exactly.
So how do we prevent it? One
of the things we do is, one of the key things we tell patients is to stop smoking. You know, we want to make sure their blood sugars are under good control, their hemoglobin A1C is within an adequate range, that they're on the appropriate medications for their elevated cholesterol, that their blood pressure is...
Is it hereditary?
It tends to run in families too. I mean, there are some things that you can control, but one of the things you can't control are your genes, unfortunately.
Okay, so if you were going to get checked out by a doctor, do I say, hey, by the way, PAD runs in my family? Like, is it important for me to let the doctor know this is something we need to check out? Right,
it's important that you let them know. And also, they can do some simple tests, you know, some non-invasive tests, and give us an idea as to where the blockages are. One of the key things important with peripheral vascular disease is also indicated that you may have some coronary artery disease as well.
Okay.
We do several tests in our vascular lab, where non-invasive tests, including ultrasound, we can do an ankle brachial index or segmental pressures to give us an idea as to where the blockages are and how to treat them.
Now, is there a particular age group that this tends to affect more so than the others, or can this happen to anybody at any age?
It tends to occur more so in people who are older. I'm not terribly older, but you know, the same risk group that have coronary artery disease are the ones who are at risk for peripheral vascular disease.
Okay. And now, when we're talking about PAD, is this something that's covered by insurance?
Yes, yes. With peripheral vascular, it is covered by insurance, and actually, we have our own outpatient lab.
Okay.
And we can do many of the procedures in our lab, and it should be covered by our insurance. We make sure it's pre-approved before we do anything.
Gotcha. All right, Dr. Malone, thank you for joining us today. PAD, something we definitely want to keep in touch with you with. And how do we get in touch with you?
Actually, I think our website is listed at the bottom, cvmusa.com.
Okay.
And we have offices actually in Maryland, D.C., and also Virginia.
All right. Thank you so much for joining us today. Appreciate it. Stay with us, folks. We have more of Let's Talk Live coming up right after the break.